Hi, I'm Emma, and I'd like to thank Healthcare Otago for the amazing chance to do a 10-week studentship over summer. I'd also like to thank Paul Smith and Yuwen Zeng for this chance. I've really enjoyed working in the lab, and it's been a really great experience. Thanks.
Yeah, that's traffic. Some people can't.
The inability for some people to hear normal everyday sounds like traffic is not uncommon following treatment with aminoglycoside antibiotics. These drugs are great at treating bacterial infections, but they often render a lot of patients deaf or with at least hearing deficits. The auditory system sits within the inner ear and contains the cochlea, a coiled structure which looks a bit like a snail shell. Within the cochlea are collections of cells called hair cells. The hair cells receive sounds that enter through the ear, and they change them into signals which the brain can use. The brain can then interpret these signals, and this is basically how we hear specific sounds and understand what these sounds are. Sadly, use of aminoglycoside antibiotics kills these cells off, which means that when sounds enter, there is much less of an ability to interpret them, and it basically results in hearing loss. Sadly, this is irreversible, and it is a global issue, especially because these drugs are used extensively in developing countries where they are very cheap. The current project involves looking at the aminoglycoside antibiotic Gentamicin in conjunction with Interleukin-10. Interleukin-10 is hypothesized to have a protective effect and reduce the death of the hair cells. This is because it is able to protect the cells from cell death, which gentamicin normally causes. So therefore, they are more likely to stay alive, which means there will be less hearing loss occurring.